This is Mariam, and she's concerned about what?
Gravity's setting in, droopy face,
Okay.
wrinkles.
And that's what a lot of people are thinking, is that as we age, our faces droop and get longer in gravity, but in reality, your face doesn't get any longer. What happens is we lose volume in our upper face. When the volume's gone, then the face drops. Okay, so in some cases, somebody has a massive weight loss, their skin might drop, but they lost fat. And as we age, you lose your deep fat pockets. You know, if you go to church, you look at daughter, mother, grandmother, you see a progressive hollowness of the upper face and mid face and heaviness down here. So it is gravity, but it's gravity result of fat atrophy. So we're going to do filler in this area here, right in the temple, right down the bone, basically. A lot of mid-face hollowness. So I'm going to basically fill up this entire area. And also to get her neck lifted up, we're going to elongate her jaw. So you lose a little bit of dentition, a little bit of bone. And she's going to do her lips. I'm going to do her lips last. I like to numb up for the lips. And for the movie, if I numb up for the lips, her lips will be kind of crooked and her face will be crooked. Okay? We'll do a little bit in here and a little bit in here. We'll probably do a little bit in her tear trough. But mostly we'll focus on building up her mid-face. So I'm just going to wash this off and then. So this fortunately is Crayola, so it comes right off. So we're going to be doing all bolus injections just to simulate fat deposits. We're putting it nice and deep where the fat pockets go. When I first started doing filler, we were doing everything really super close to the skin in order to economize the filler, but now we're doing things much deeper. So here we have, let me just grab my box there. Here's a box of reconstituted Juvederm. Basically, we take the Juvederm and we mix it with saline to make it softer, and I'll use that for some of the areas. In other areas, I use the full thickness Juvederm. And how I make the decision is based on if I'm going close to the skin, if I'm going to some place that a lot of stiffness is needed or not. So put your head back. And typically in the temple, I'm going to use reconstituted. It seems to give the right amount of lift. So I'm going to go right down to her skull. Just pull off it a little bit. We don't inject her periosteum. And just do a nice injection. And you have to go real slow. When you do the reconstituted Juvederm, they'll feel the little air bubbles. That's probably not enough. Up just a little bit higher. Try to watch the blood vessels so I don't bruise her too much. I'll withdraw my needle slow so I'm less likely to make her bleed. That was like 1.5 in her temple. Actually, I'm going to switch over to the non-reconstituted now.
This one?
This is Voluma here. I use some Volumas down deep. So for Voluma, we're going to use right in our deep malar fat pad. Now take some Juvederms. Straight Juvederm? Yep.
This is straight.
That's
fine.
this is Juvederm too. This is Voluma.
That's Voluma.
Okay, thank you. This is Ultra Plus. Ultra Plus, yep. And can I see a Voluma now? I'm going to do the V1 and V2 on her because she is very hollow in her upper face. So go right here in a zygomatic fissure and go right down the bone. About 2.2 and mash down. In this case, instead of going into a deep fat pocket, I'm going to cheat a little bit by going on top of her malar prominence, which is something you can do with Voluma. It gets a nice amount of stiffness and just barely enters the skin. And I can't bolus this because I'm not as close to I'm not as deep into the tissue, so I'm going to do like maybe 0.2 or 0.3 at a time. Right down the bone, 0.1, down the bone, So this cheek has 2 syringes of Voluma and 1.5 of Juvederm R and a couple syringes of Juvederm. I'm going to use a bunch of Juvederm for a mandible.
These are Juvederms? That's R, this is non-R.
Okay. So I'm going to go right onto her bones. I'm feeling her mandible, right down to her chin. So you run along the angle of her mandible. Take another Juvederm regular. To her mentalis, on the bone. I'll take some R's. These are R's right here, thank you. And the orbital rim. Take another R. Is right here, thanks. Right here in the little canine fossa. Aspirate this very vascular area. I typically bolus it. I know a lot of people thread it. I don't think it's necessary. When you bolus it, you're going to get a little longer time to break it down. For a marionette line, I'm put a little bit in the corner of her mouth here. And we'll go from the lip out to create a little, like a suspension bridge. Okay. Now right here in the mentalis area, this lateral mentalis into the witch's chin. Correct that little divot. Probably use more R. Thank you. That's okay. So I'm going to go just here in her subcutaneous tissue, which is kind of hollowed. Right now I've done a few syringes. I'm just going to have her sit up so I can see her in a more upright position. I'm going to sit right up at medium. Okay, look right straight at the camera. And we can see we've completely rotated her face upward. She's still hollow here underneath her eye. Her mouth is tipped up. It almost looks like she's had a stroke where she's droopy here and she's lifted up here. This little witch's chin is gone, so the jowl is pretty much gone. Feel a little bump there, so I'll smash that out. And by injecting along the mandible, you basically elongate the mandible, which lifts up the neck. I think she's adequately filled in her temple. She'll probably use a little bit on her orbit and right here in her lateral orbit. Let me come around where you're at. You can just keep that right there, Quentin. So I'm going to have Teresa do just in her, underneath her eyes. She's really good at lifting that up. I'm going to put a little bit more in your lateral orbit.
You can rest your head back there.
You can put your head on back. There's different ways to do this, I suppose. I'm just going to put little tiny boluses along her bone. And you got to go pretty deep where they're visible. And I'm definitely using R here. I don't think you need much stiffness. I'm aspirating each time. I just use 1/2. Why don't you go ahead and do her, fill her here a little bit more. These are empties here. So here's 1, 2, 3, 4, 5, 6, 7, 8, 9. Now describe what you're doing.
Just creating a base here underneath the eye. Then you kind of push it towards the globe, and it fills in that crease, and it builds a foundation so you can fill the rest around it. The ice helps to constrict the blood vessels and reduces bruising. Just aspirating, 'cause it's so vascular.
If you go to meetings, doctors will talk about the fact that you can't aspirate blood through a syringe because they did experiments where they take a Juvederm and they put it in a little red liquid and pull it back. Problem is there's no systolic or diastolic pressure in a bucket of water. So when you do get into a vessel, you'll find out. In fact, Dr. A had some issues in Bellafill, and Dr. Sadik was out here and he says, "Oh, you can't aspirate," and sure enough, she got a little blood, right? Proving that you can get blood.
Yeah.
So we're going to use about 25 or 30 syringes of filler on her, a combination of Voluma, reconstituted Juvederm, and Juvederm. And if you're trying to get by with 2 or 3 syringes of Juvederm, you can't go this fast because you got to be real economic with your filler.
Very good. I'm so blessed for all of you, especially you.
Yeah, looking good. Sometimes you can see the skin tense, and that's okay. The less pokes you do, the less likely they'll get bruised. And you can see with the R, you just mash it out. It's very pliable. Some places like here, there's barely any coverage, so as soon as you put the filler in, it tense like that.
Another thing to do is to pull your needle very slowly because then you kind of seal up the hole and you don't bleed as much. If I'm in a hurry, it looks like I removed your kidney. There's blood all over the place. But if I take my time, it looks pretty damn good. That was a bad analogy for the video. There's hardly any bleeding at all.
When you do the under eye, you can palpate the edge of the orbital bone there, and you just keep below that. So we're working our way up there. Sometimes I use my finger to guide the filler. You can, if you put your finger on the face, you can feel which way it's flowing, and you can build like a little dam to make it go one way or the other. And it'll look a little bumpy when you first do it, because it starts to swell.
May I speak a few words?
Mhm.
Much. Is it normal to feel the corner of my eye on the outside to feel like it's actually drooping?
Yes.
It'll be from the anesthetic.
Yeah.
Yeah,
okay.
you'll feel even your lip getting numb and your nose may feel funny.
It just feels like it's coming down, like there's a weight
Yeah,
on
it's
the
not.
outside. Right?
It's just a numbness. Numbness makes things feel heavy.
Good to know.
You look like a zombie, don't worry.
Thank you. That's okay.
You have a wet cloth handy?
So after we're done this side, then we'll take the video off and do the other side, okay? You can train with that.
And this one, you don't go straight towards the bone, you kind of go at an angle. And I inject super slow in this spot. sometimes you have to build that little dam. The reason why I'm going super slow is as the filler goes in, if it's pressing on a vessel, you'll see it immediately. And this area fills, it doesn't take much filler, so you can see what you're doing pretty quickly. And then you just kind of force it up near the canthus there, where it's not safe to put your needle.
Keeping our needle count. Come here in there.
Five the balloon and 9 they reconstitute.
Okay.
Can you tip your chin down for me real quick? Good.
That's good.
That's great.
So we use 15 syringes on this side, so this would be a 30 filler case. So we have a few Voluma, a few Juvederm, and some Juvederm R for the areas that were more superficial around the orbit, not as stiff. And we're gonna have you sit up for a minute. And put your head, look straight into the camera. You don't have to look up. And you see how much her, I'm gonna come around this side, but you see how much her face is kind of rotated up. Her steatoblephron is not even really visible anymore. Temple's filled out, it's even starting to puff a little bit. Her mouth is lifted up on this side real smooth. Her chin is wider. Her mid-face is wider. And that's what it takes, is a lot of filler. You know, back in the day we were doing 3 syringes of filler. You couldn't possibly achieve this results, but that looks fantastic. So we're gonna take offline and do the other side, because we're doing some training today, and then we'll do a before and after on the video.
One last comment, the under eye area, in about a month when the filler softens a little, it's a good time to put a second layer in so that it looks very natural. Right now if we put more it would just look kind of bulky, so it's good to correct it about 75%, let it settle, and then do a second layer.
Perfect.